Today we are at the Zimbabwe National Family Planning Clinic, which specializes in reproductive health, which include a lot of topics. Today, specifically, we are going to talk about prostate cancer. So when we talk about prostate cancer, we are talking about issues that originate from the reproductive system of a male gland. Prostate cancer is the cancer that happens in the prostate gland. So what is prostate gland? Prostate gland is a small gland or a small organ which is the size of a walnut. If you know a walnut, and the walnut size thing is actually here, if you look at the diagram of the prostate, of the reproductive system of a male gland. So the prostate is all this gland which is labeled here. So that gland is there and is there as a part of reproductive system, not of the urinary system. Now, what happens when a person develops a prostate cancer? If we want to define first what is cancer, cancer is a change of function or the malfunction of cells that are in the prostate. So in any organ, when you develop cancer, it means the cells within the organ are not functioning the way they should be. In other words, it means they are not following the coding or the instructions that are given by your body. So they are developing on their own, they are doing their own thing. So it means they are now doing their own thing. They are going to end up maybe causing the bleeding, growing out of proportion and the like. So it means your body cannot control. So in any case, that's what happens with the prostate. So when the prostate does that, what happens? You develop growth, you can develop bleeding and all the like. So then what happens? If you look at the prostate gland here, we have got the vas deferens or the tube that brings the sperm up there. It passes through the prostate. And then you got the urethra, which comes from the urinary bladder to the penis, also passes through the prostate. Then what happens? If this structure here is growing massively, it means it's going to press on the ejaculatory duct, this one, or it's going to press on the urethra, on the urine. So when that happens, it means the client is going to have a problem. And these problems, what happens is actually we are now talking about symptoms or signs of prostate problem. What are the symptoms? The symptoms is when you feel like you want to go to the toilet. You go to the toilet, you want to pass urine doesn't come out easily. So a person develops what we call hesitance. It means you are hesitating to go to the toilet because when you go there, you cannot pass urine easily. And for men, health-seeking behavior is very bad. So they keep on saying, I can keep on trying. You keep on trying. But eventually, the urine will not come out. Or you have problems, urine, and you keep it like that, end up with problem. Another problem is urine stream. If you look at a young boy has got a urine stream which is very nice, going there like that. But when you are an old person, the urine stream becomes weak and sometimes you get what you call dribbling. This because of pressure that is being applied by the prostate which is growing. Then the other problem that you can end up with is having urine which is blood stained. It means the cells here, as I've alluded earlier on, they've got weaknesses. They are developing so fast, so they become very irritable. If they come in contact with something, they can bleed easily. So you get urine which has got blood. Sometimes as well, a person can have sex. When you have sex, your ejaculation here for the fluid that is here to come out through the urethra on a time of ejaculation, it becomes painful and sometimes difficult. And because of that difficulty, you can have erectile dysfunction. It means your erections, because you've got fear, then the erection is not there. So those are the problems that the person with enlarged prostate can end up with, or with prostate bleeding. You end up with those problems. So what it actually means when we say you've got prostate cancer, what does it mean? Prostate cancer is not diagnosed or is not assumed to be there when you have got the signs and symptoms that I've told you. It's not. Signs and symptoms can mean that you have got problem of prostate, but not necessarily the cancer. The cancer has got a specific test which I will talk about later on. So enlarged prostate doesn't mean that you've got cancer. So what does it mean? It means you've got a problem. So that problem must be seen by the doctor or a nurse who is competent in reproductive health. So then the person will be able now to find out if you've got prostate cancer or no. Why I'm saying so, we've got two types of prostate problems. One is cancer, the other one is called BPH. That is abbreviation, but in full it means benign prostatic hypertrophy. What it means you have got an enlarged prostate, which is pressuring on these tubes, so that urine cannot come out, but you don't have cancer. It means that prostate is just grown out of proportion and is putting pressure on the tubes. That is not cancer, it's just the enlargement. But you can also have an enlargement with cancer. Then that's prostate cancer. You might not have all those enlargements. Urine is coming out, generally not very bad, but you have got problems of prostate cancer. So that will be differentiated by the tests that are done. That is to rule out whether you have got cancer or no, whether you've got an enlargement or no. So what are the investigations that can be done? The investigation that can be done, one is what is called PSA, which is called prostate surface antigen. That is a protein that is produced by prostate, and it is detected in the blood. If your blood is collected and then the tests are done in the lab, then the results come out, the doctor will interpret for you, and they will tell you whether you might have prostate or not. I'm saying might because that's not completely the answer that if the prostatic surface antigen PSA is high, you have got prostate cancer. It's not true. But it might suggest that you might have cancer because there are further tests that can be done. So that's one test that can be done. Second test is what we call the DRE, which is digital rectal examination. You actually use the doctor will use his finger or her finger through the rectum, and then you palpate or you feel for the prostate, whether it is enlarged or not. Then the other one is called the MRI or a scan. The scan will actually visualize the whole prostate and see whether it's enlarged or not. So those are the tests that can be done to determine whether you've got cancer or not. Now, those are not exhaustive. The last one, it will be biopsy. Biopsy means we take a portion or tissues from your prostate gland here, and then we send it to the lab and they analyze the type of cells that are there. So only one test cannot give you a conclusive answer to say you've got cancer, but it will give you only a suspicion. So that's how we can diagnose prostate cancer. So why can we treat prostate cancer? One answer is yes, we can treat prostate cancer. The other answer is we cannot treat prostate cancer. Why I'm saying so? Number one, we said we can treat. We can treat yes if there's early detection of prostate cancer. Is where now will come the issue of early screening, which is more important. Because all the signs and symptoms that I've been talking about, when you see them, it means the cancer might be very advanced. So we don't want to reach that level. We want a person to have a routine checkup. Then if it is early detected, you can be treated either by radiotherapy or operation or otherwise. It will be treated and it will go for good. Then that is we can treat. We cannot treat if it spreads, because when you get cancer cells in the prostate here, it means if it is advanced, it means all the cells have been affected. So they will spread through your bloodstream to all parts of your body, especially what we call lymph nodes. And there, The lymph nodes is where your soldiers in the body, not my white blood cells, they will be produced there. So automatically they will be infected and then they spread the whole body. Then it means you can't treat. So general cancer, there is no drug that treats cancer. The treatment is early detection. Now early detection, when we say early detection is found when a person goes for screening test, which is the program which is done by many organizations, including ourselves. We are going also to start doing screenings. So the screenings, who should go for screening? That one is debatable. It also depends with countries. In other countries, screening can start at 40 years. Like in Zimbabwe, we encourage people to start at 40. In other countries, you can also start at 50 years. So when you are at 40 or 50 years, you are likely to have problems with the prostate. So you must start having screening of prostate cancer. That's what is recommended. When you screen, that's why we're saying go for screening early, and it is picked early, you can be treated. If you delay to wait for bleeding in the blood, in the urine, and other things that they've talked earlier, then you might have problems when the cancer is already spread all over the body. The person who has got a family history of a parent who had prostate cancer, who are at high risk, and usually these people with high risk are saying you can start early for cancer screening. Then there are also people who have got people who are black people, they have very high risk than white people. Then the other issues, people with maybe repeated infection, STI infections, when they might end up with prostate problems. So these are what we call risk factors. Some people can talk about diet and that, but that is not well established. But those two areas, they are the critical areas where people can actually encourage. One, that's one. Two, you might have been screened and you have been seen with some of the problem like PSA, which is high, but all other factors are okay. That can actually also put you in the group of risk factors and say, okay, your PSA is high, everything is okay. So we are changing your screening time so that we screen you regularly, so that when a problem develops, we can pick it early. So that's another version. So it can come in different ways when we say this is a risk thing. So that will determine. But otherwise, generally, screening is done regularly on an agreed period. We don't wait for signs and symptoms. So, in brief, that is the prostate cancer and how you can screen prostate cancer and how people are checked.
Plan by desired number of children, spacing and timing of births. Prevent unintended pregnancies by using short and long-acting family planning methods.